And welcome to day 8 of 10 days of alternative medicine education sprints. Today I'm very honored to be hosting Chloe Sardin. Hi Chloe, thanks for joining me. Chloe is an osteopathic manual therapist with many years of experience and a very impressive toolkit. I met Chloe about a year ago when I looked for a way to help my daughter with her growing pain, and I loved Chloe's energies and patience right away. Chloe is taking a special interest in treating babies and children, which is leading her after doing a pediatric postgraduate program in Oregon to further it even more with 6-year part-time postgraduate program in pediatrics in Switzerland and Germany. That sounds very exciting, and I would love to hear more about it. So, welcome. Thanks for joining me, Chloe.
Thank you for having me.
Tell me a bit about what is osteopathy and what it does treat.
So osteopathy is challenging to explain because I find there's no easy way to explain it. So a chiropractor will manipulate bones in order to restore the bodies back to health. A physiotherapist will use muscles, whereas an osteopath will use bones, muscles, and guts and nerve and connective tissue and blood flow. So it can't really be defined by what we treat, but what we're trying to do. So I find the best definition of osteopathy is a practitioner that look at the body as a whole, meaning the symptom is the signal, but it's not the true cause, and will work on the body from head to toe and all of its symptoms, all of its systems, in order to find what the root cause of a problem is.
And I heard many parents talk about how osteopathy and especially cranio-sacral can help with colic with babies. So can you tell us more about that?
Yeah, so once again, when we think colicky, most parents will come and say, my kid's guts is not going like good. I think my kid is colicky, and either they say the doctor said it was fine or it's normal. And I don't think a kid that struggles is normal. I think we can help them, but we also have to figure out what exactly it is that's disturbing their guts. So it could be mechanical during the birth. Either it's a C-section or it can be a long delivery, short delivery. All of that is going to put a lot of stress on their body when they have to work their way through the birth canal, or when they're pulled out of the uterus. If it's a C-section, it pulls a lot on them, and it can cause strain. Like, that's the best way I could define it. And then it's our job to figure out what are the different systems that were affected. So is it the base of the skull, for example, that would be affecting the brain, like the brain-gut feedback nerve that's called the vagus nerve. There's one on the left and one on the right that's responsible for the left-hand side and right-hand side of the guts. It could be the diaphragm. That's quite typical. The diaphragm helps us breathe, but also has got the nerve for the digestion that goes through. And can affect also the stomach function, for example, because the stomach will go through to get all the way up to the mouth through the diaphragm. So now if they kind of cork their way through the birth canal, or if the first breath wasn't as strong as what we'd like it to be, then we'll see kind of like a typical pattern of like dysfunction inside the thorax in that diaphragm area. Lastly, another thing that we need to consider for kids that are colicky is, are they like fed like well? Are they fed enough? Is there anything that mom is eating, if they're breastfed, or that they're eating through the formula that they can't digest? And then we'll see them being cranky because they're struggling to digest well. And with that comes also the balance of bacteria that they're trying to develop. So for example, a C-section baby won't have the exposure through the birth canal of being exposed to all of mom's good bacteria. So we know those babies, unfortunately, will start a bit deficient in that, growing the good bacteria in their guts that will then become our immune system.
That's beautiful. I've heard that theory before, but I never really understood how it can affect the babies and then later on the child's life. So that is really interesting. So what else can you tell me about cranio-sacral? Like, is it one of the tools that you use, or?
So when I go back to the definition of osteopathy, I'd say there's three big families that make osteopathy. So we'll say there's the structural aspect, mechanical. So I might have patients that are runners that say, oh, my knee hurt, or my hip hurt when I run. And then we'll see kind of the joint part of the system. And then we'll have the visceral osteopathy, which that is all the gyno system, the guts, the lungs, the throat, all of that. We will be able to have an action on what we call the visceral, the gut system inside our body. And then lastly, the last family is called cranial osteopathy. And inside this cranial osteopathy, there's subdivision of technique, which one of them is cranio-sacral therapy. So osteopathy was created in Missouri in the States and at the last century, and then was spread out around the world. But in the United States, there's a doctor in osteopathy called Upledger that decided to teach cranio-sacral, that one particular technique made from cranial osteopathy to non-osteopath. And then it boomed and it became this thing that is so popular nowadays that is part of osteopathy. So when you guys go see an osteopath, they will have biomechanic cranial osteopathy, cranio-sacral therapy. I practice biodynamic cranial osteopathy that are all part of, if I had to simplify it, use it a bit the nervous system to help the body feel better.
Mm-hmm. That's interesting, because when I saw you with my daughter, she was suffering from a knee pain, and you were kind of putting your hand over her knee and over different parts of the body. So what do you do there exactly? Is it some type of energy, or how does it work?
For example, you said your daughter came for growing pain, is that right?
Yes, it was growing pain in her knee, yeah.
So the bones, we assume, funny enough, that if we think of a long bone, that they're going to grow from both extremity. That seems to be the simplest way that we could think a bone could grow. But that's not exactly how it grows. If we think of like a leg, like a bone in the leg, they'll actually grow from center of ossification that are not the extremities. So what I'm looking at is to see how those centers of ossification, like moving and growing, and how is that process going. And so sometimes we notice there could be tension in the joint above and underneath, or it could be a restriction in connective tissue, a muscle imbalance from kids falling all the time, or it could be this growing process that could be stalling, or it could be if a kid had a lot of inflammation in their guts,
Right.
or immune system, then like that could affect their joint, because inflammation will spread on all systems. So I can think of this young little boy that had a lot of knee issues and had arthritis in his knee, and actually the problem wasn't the knee, was that his digestion was so inflamed that at the periphery it was influencing other parts of his body. But the people that were taking care of him were just working on the joint part of it, without looking at the holistic aspect of the body and how everything is interconnected. So my job is to take the symptom as not a light bulb in the dashboard and unscrewing it, but kind of being like, okay, there's a light bulb on, but it's the body, we don't quite know what's wrong. I'm going to dig and ask questions and feel things with my hands to, with my knowledge of anatomy and pathology, physiology, get to the bottom of this.
That's beautiful, because that's what I'm trying to teach my clients, that you have to look at the body as a whole, because the symptom is not the one you want to treat. You want to go deeper and treat the roots and treat what causes it, right? So I'm really glad to hear that, and that's a very powerful tool that I want my clients to know, that there are other ways, that if they go to the doctor complaining about a pain, but the doctor can't do anything but prescribing painkillers, there is a reason, usually deeper in your body, that you can by treating that, that will help the pain go away. So thanks for sharing that. What else did I have here?
And
Yeah.
I want to say that it's not that we're against medicine. Like, I think we all have a job to play. So I send my patient to the doctor. Like, I think, you know, it's good that we have MRIs and exams and that we have anti-inflammatory drugs and painkiller. They have a place. But I just want to also kind of give the message that if you feel stuck, or if you feel misunderstood, or if you feel like your gut feeling is that there's something wrong, but everybody's telling you, no, you're fine, and they rolled out all of the medical exams possible, and you're sent home, but you still feel like you're not good, don't take this answer as the definitive, like, there's nothing wrong with me. You might be right, and you might want to seek other health practitioner that might have, I call it a different spectrum of, like, you might not die about it, it might not be something obvious enough that we can see it on medical imagery or blood work, but it might be at a level that's uncomfortable for your body, that's trying to make you shift.
Mm-hmm. Beautiful. Thanks for sharing that. So what are the top 3 problems that people come to you with?
I find sometimes people come for something and then I send them home with realizing that it was a more complex thing than what they came in for. So for example, I can think of this one patient who came because she slid when she was skating, and she's like, oh, my groin really hurts, and like, I think like something is not right in my hip. But then as we went through the treatment, we realized that she's a mom and she's an entrepreneur and she's got a ton of stress in her life, and that she's clenching her pelvic floor all the time, that she never went to pelvic floor rehab after she had her kids, and how there's still some muscle imbalance because we'll tighten up the pelvic floor as a survival mechanism. And then her guts are a bit inflamed and she never realized that she might be eating some food that she might not actually really be digesting well. And then so I find what people come in for, I try to integrate on like how could we make you as functional as possible. So I'd say lots of people come for joint pain or back pain, and then we discover that there's more that meets the eyes, and I try to educate my patients to understand why they feel the way they are, and then give them the tools to be able to manage it on their own, because it's not my job to sustain their health, but it's my job to help people understand their body and find the tools that work for them.
Yes, and this is like practitioners and coaches like me and like other practitioners I've introduced during my 10 days of this marathon. They can come and help with coaching about nutrition, with coaching about physical activity, with coaching about breath work that can release stress, yoga that can release stress. And once you release all the stress and you eat the foods you need and you take care of yourself, things will gradually work themselves out. So yeah, that's beautiful. Tell me maybe one beautiful success story you just recently had with one of your patients.
I can think of this one mom and baby, and she wanted to have a natural birth, and she like did the hypnobirth thing, and she had a midwife, and she was so prepared to have a natural delivery and as hands-off as possible. And then life happened, and then the delivery was taking too long, and so they did all the thing they could do to try to make her go in labor as naturally as possible, and then that didn't work. And so she ended up having a C-section, and I saw her and her little girl after, and they were beautiful, but I could feel she had so much guilt carrying the burden of, I failed my child, and now she's not going to have all those good bacteria, and they tore her out of me, and like I failed her as a mother. And so I find mom often will bring their kids to help them, whereas I think mother and child are one even after the birth and for a long while. And so I treated them both, and I feel like they're fine. And her feedback was, thank you so much for helping me not feel as guilty as having broken my kid because she didn't come out the way she was supposed to, and making me feel like I didn't fail as a mother.
It's a beautiful
That's
story.
beautiful. Yeah.
Yeah, it is beautiful because, yes, we do carry that mom's guilt about not feeding our kids the right food or not playing with them enough or not reading to them enough. But especially now with this whole Corona time, it's so hard to be a mom and a full-time employee and do all these things. So my advice to those moms, just do your best and don't feel guilty about what you can't do because you can't control it. So yeah. So before you wrap up, anything else you would like to share with us?
Don't feel afraid to ask for help. I find sometimes kind of seeking help from a practitioner, I find there's different things that play a role. But you want to be strong and it's a bit uncomfortable to come and ask for help. And then osteopathy is not well known in Alberta, whereas it's quite known in Europe, where I come from, for example, or in the United States, it's more known. And I hope that people can read about it. There's websites and things that can help them understand a bit better what osteopathy is and know that we care about our patients. And I hope that we can be inviting enough that people can trust us to maybe try it out and see if that might be the right fit for them.
Good, good. Thank you so much for joining me today, Chloe. It was an honor to have you here.
Yes, thank you so much for having me.